Hi, my name is Felicia Clark, and my informative speech is about COVID positive women who are just days from giving birth. I'm going to give you a clear picture of what some parents experienced during this pandemic and the challenges they faced. I'm also going to explain what it means to be COVID positive, where it originated, how it spreads, and how to contribute more to the solution and less to the problem. I remember it like it was yesterday. My husband and I were getting ready to put on our costumes so we can participate with the trick-or-treaters every Halloween, and we knew we had the best costumes and the best candy on the block. We had been trying for years to conceive, and with all of the stress, we just gave up until we were emotionally ready to tackle it again. I hadn't been feeling well for a few days, and I wasn't sure what was wrong. I told my husband I would go to urgent care tomorrow to have some labs run. A couple of days later, my physician called and told us the best news we've heard in years. You're pregnant. I was so overjoyed, I made an appointment right away for a well visit. My husband accompanied me, and although we couldn't make out what was on the screen, we were stoked. The doctor printed out a few pictures that I held on to for dear life. Fast forward to the gender reveal because we didn't want to wait, and it was confirmed that we were having a baby boy. We didn't care as long as the baby was healthy. A few days later, news flashed that there was a pandemic taking over the world and we needed to brace ourselves because this was something no one could imagine. Day to day, our lives changed drastically. First, my job closed its doors. My husband is an essential worker at the hospital, so he continued to work. We were so careful and anal when it came to cleanliness, and my husband stripped down out of his work clothes in the garage to be sure not to potentially bring anything into the house. My next appointment is nearing, and we get a phone call from the doctor's office stating I'll have to come alone, only one patient at a time, and be sure to wear a mask. It was the very first time I was worried. I had a talk with my doctor, and he told me that the goal is to deliver vaginally, but if for any reason I have to have a cesarean, my husband wouldn't be able to see the birth of our son because it's too risky. By July, I was ready to pop, and 5 days into the month, my water broke. I was in active labor. When we got to the hospital, we both had to be screened and masked. I was only 2 centimeters dilated, but the baby's heart rate was decreasing, so they kept me to be monitored. I was in isolation until the test results came back for COVID. I was positive, and so was my husband. We had no idea and had no symptoms. They transported us both to a special room where it was just us. Every time someone came into the room, it was very quick and abrupt, and they all looked like astronauts. I didn't feel human. I felt like an experiment. This is the absolute worst time to bring a child into this world, but what could I do? We both had on masks. I couldn't breathe correctly, and every time my body was taken over with pain, I snatched my mask off unknowingly, and they would put it right back on me. They kept stating, you have to keep your mask on to protect your baby. After 24 hours of labor, our baby wasn't making much progress down the canal, so they started to prep me for an emergency C-section. I was so scared, and my husband had to stay behind. Behind the curtain, I could hear my baby wail out, and all I wanted to do was kiss his face. I was told I couldn't and to keep my mask on, and they explained to me the next 14 days would be very crucial, so I listened up. I want to explain about the coronavirus. Coronavirus is a new virus that has not been previously identified. It could cause mild to severe illness. Mild as in asymptomatic, meaning no symptoms, to a common cold. Severe is known as upper respiratory distress that could block your airway and make it difficult to breathe. According to Center of Disease Control, the first U.S. cases of non-travel related COVID-19 were confirmed February 26 and 28th of 2020, suggesting that community transmission occurred by late February after a single importation from China, followed by multiple importations from Europe. The outbreak was first identified in Wuhan, China, the end of 2019, hence the 19 in COVID-19. The virus that caused COVID-19 is thought to spread person to person, mainly through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouth or noses of people who are nearby or possibly be inhaled into the lungs. Spread is more likely when people are in close contact with one another less than 6 feet apart, and it seems to spread easily and sustainably. I currently work in pediatrics, and there are currently quite a few pregnant COVID-19 positive women that are expected to give birth within 1 to 2 weeks. The process is right after the baby is delivered. The baby is swabbed for COVID-19 that day. On day 3 to 5, depending on if you had vaginal birth or cesarean birth, the baby visits the pediatrician's office. This is where the baby gets a full physical and is swabbed again for the second time. On day 14 after birth, the patient and caregiver, preferably not the COVID positive mother, is brought in via back entry. A nurse goes out and retrieves one parent or caregiver and provide them with a surgical mask and escorts them in. The physician calls the parent or a caregiver over the phone inside the exam room and takes care of the verbal part of the visit and address any concerns a parent or caregiver may have. The physician then dons on their personal protective equipment. Once the physician is in the room, they check vital signs and the last and final COVID swab is administered. Once the results are back, the patient and parent are cleared and they can now enter the building from the main entrance. So what happened if any of these COVID swabs are positive? I'm guessing that they would have to self-quarantine from 10 to 14 days from the date of the positive swab and then test it again. I'm actually not sure because I'm proud to say that we have not had one case of a baby being born with COVID, with a COVID positive mother test positive. And we've had a total of 15 cases thus far at our facility, whether the mom is breastfeeding or not. In conclusion, the virus is new and the studies are still underway to pinpoint what needs to happen to slow the virus down. Cases are still on the rise, but the severity of the symptoms have eased up and the deaths are increasing at a slower pace. Everyone is affected by this pandemic. Ways to help out with the solution is by keeping distance of others by at least 6 feet. Don't gather in groups. Aside from work, stay home as often as possible. Wear your mask to protect yourself and others. Use hand sanitizer. And last but definitely not least, and one of the most important things, simple but yet very effective, please wash your hands. Thanks for watching. Thank you.